Hi, this is Robin Webb Corbett. I'm pleased to be with you today at ECU CON Hospital. At this point in time, we will be working with a woman in labor, and at this point, we want to take you into the room and meet. And you, ma'am?
Hi, Melissa.
Melissa, hello. Thank you so much for letting us be with you today. And you, ma'am?
I'm Jenny. I'm her nurse.
Oh,
Okay.
it's so nice to meet you, Jenny. How are
Start
you
your
doing?
breathing.
It looks like she's having a
In through your
contraction.
nose, out through your mouth. Excellent. Good job. You want me to rub your belly? Will that help? Okay. And this is called effleurage. Okay. And what we're doing here is it's just actually a relaxation technique. Okay. Deep breaths. Okay, you're getting up to the top of that contraction. Should be starting to ease off now. Good job. Good job. All right, as soon as it's over, I want you to just try and relax. Okay, good. What you need?
I think I want to try the chair.
Okay, the ball?
Ball.
Okay, okay. All right, what I want you to do is come on.
The ball, ladies and gentlemen.
And you always want to make sure that a support person or someone is here to make sure that the patient does not fall off the ball. Okay? I want you to come in front of it and turn this way, and you're going to use the bed, okay? Sit down on it.
Now, what will this do, Nurse Jenny?
This is going to help open up the pelvis and allow her to rock and use her own body as a relaxation technique. And if she's having... You want some ice? All right, you got it. You got it. She's going to be using a little bit of aromatherapy with her lavender candle to help with the relaxation technique. We can also, if they're having back pain, apply counter pressure to the lower portion of her back during a contraction, and this will help alleviate. It actually applies pressure and alleviates some of that back pain.
Is it helping, Melissa?
Okay, wonderful. Keep your breathing going. Keep your breathing going. All right.
I'm going to be sick.
Okay, okay. Okay. Breathe.
Not expected.
Breathe. Okay. All righty. You should really be having gloves on when you're dealing with emesis. Okay. And a lot of laboring women
Get sick?
A lot of laboring women do. It's a natural response to pain. All right. You want some more counter pressure? What you need? What you need? You want your ball? I can do some pressure with your ball. Sometimes if you use a ball, it actually applies more pressure than just the palm of the hand. For good technique.
Is this helping, Melissa? Good.
Would you like your back massager? You think that would help some? Okay. So you use the back massager. Sometimes this will alleviate it. Sometimes patients use tennis balls in a sock to apply a little bit of pressure.
Can I have my epidural?
Yes, ma'am. Yes, ma'am. Okay. I
Ladies
think I
and
saw
gentlemen, we'll need to
anesthesia.
walk out of the room while that gets set up. But as you can see, we're using different methods to control her pain. One, as you can see, the ball that she used, and what that was doing was widening her pelvis to facilitate that delivery process so the baby drops into the pelvic canal to be delivered. The other thing we talked about was aromatherapy. As you saw, she had a large candle, a lavender candle. We also had, we're doing effleurage, where you take your hands and rub those on the belly. She also did counter pressure with the back, with her fist of her hand, and did that. And then she used a ball to apply pressure to her back to deal with that counter pressure. Now, when those were no longer effective, the patient, Melissa, then said she wanted her epidural. And that's another pain method, and that's a type of spinal that she can receive. And to receive that, we have to leave the room. Anesthesia comes in, and at ECU College of Nursing, we're proud to share with you that we have nurse anesthetists here, and they are going to facilitate the administration of this epidural. They are well known in our area for doing excellent care, and they provide our anesthesia for our patients here in the area. When we do this, we need to get Miss Melissa set up, and anesthesia needs to come in. This is a sterile procedure, and right now we're going to talk to anesthesia and see what she's doing exactly. Anesthesia?
Hi, my name's Frida. I'm from anesthesia. I'm here to give Melissa her epidural.
Thank you.
What I'm doing right now is just cleaning her back off. Okay, this is a sterile procedure, so we clean her back with antimicrobial agent to make sure that we don't introduce any germs into the epidural space.
Uh-huh. Now, Nurse Jenny, what's she doing with the pillow right here?
The pillow is just for support. The idea is to curl around it so that it opens up that spinal space. And what I'm going to actually do is be turning on the fetal monitor that I have placed on it, because when it's an epidural, you can actually, you can actually have fetal heart rate changes. Keep your breathing going. That's good. Good job. You got it. Focus on me. Focus on me. You're getting up to the top of it. You're getting up to the top of it. Okay, it's going away. There you go. And while she's getting your epidural ready, I want you to just try and relax me. Good job. Good job.
So she's working with the breathing.
To make sure that you don't move during the epidural, okay?
And as you can see, ladies and gentlemen, we've got a fetal heart rate up there, and we're looking at her contractions. Looks like she's got a good fetal heart rate, which is good, Melissa. Okay?
What was her last blood pressure, Jenny?
The last blood pressure was 123/82. Okay, so we're doing good?
Okay, great. All right, Melissa, we're ready to start. Now, remember, we talked about this before, okay? So what I'm going to do right now is put in the numbing medicine. So you're going to feel me touch your back. You're going to feel a little sting right now. Sting, 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 dark move. What we do is numb up the skin so that when we put in the epidural needle to place the catheter, that's not uncomfortable for the patient.
Good.
Okay.
You have another contraction right now? Okay. You're going to have to hold still.
Okay.
Breathe.
Okay, just breathe. You're doing great.
You're doing good.
You're doing great.
You're doing good. But you got to keep breathing. Keep breathing.
Let's get you to say. We need a breath there.
There you go. You got to keep breathing. All right.
Okay, good, Melissa. Now, what I'm going to try to do is get this needle placed before you have another contraction,
All right.
okay? I want you to relax.
So whatever, but
Let your shoulders go down, okay? Just relax. Stick this part of your back out. That's great. Now, you're not going to feel any pain. This is just going to be pressure, okay? Just pressure. Just pressure. You're doing great, Melissa. You're doing great. Okay. All right.
Start another contraction. Okay, just keep breathing. You got
Okay,
it.
keep breathing. You're doing fine. You're doing fine. Okay, Melissa, I've got the needle right where I want it. Okay, it's real important if you'll just kind of hold still right now. We're going to place the catheter. Okay, then we'll be able to put your medication in there, okay?
And then you won't feel any more contractions.
What I'm doing right now is just threading a catheter into the epidural space, and it will stay there. We'll hook up an infusion of local anesthetic with a little narcotic in it, and it will give her continuous pain medication throughout the labor. She will not be able to feel her contractions after this, okay?
Oh, good.
It's also going to be important that she stay in bed because it may make her legs a little weak, and we don't want to take the chance that she might fall, okay?
Nurse Jenny, can you tell me why the question was about the blood pressure?
The question is because with the medications that are given during an epidural, it can cause the blood pressure to bottom. So we always want to make sure that we know a good blood pressure, and with bottoming blood pressures, it can affect mom, but it can also affect the fetal heart rate.
Well, they said something about right before we came in about a bolus of fluid. Can you explain that to us?
You always want to try and give at least 1,000 cc bolus of IV fluids prior to an epidural being placed. Okay, and that's so that the blood pressure does not bottom out as much.
Good job. Thank you.
Okay, we have our catheter in place. We've started the infusion. And what I did was give her a little bolus, which means I gave her a little dose up front, okay, to get her epidural going, get it on board, get the levels up. So she's going to feel relief in about 10 minutes, okay?
Good.
And then this will continue throughout her labor.
Good. Thank you so much.
And
Melissa, how do you feel?
I feel a lot better.
Good. Good.
And one thing you want to make sure as the nurse that you have that bed, the head of the bed angled at about a 45-degree angle so that the epidural does not actually go into the level of the lungs and the cardiac muscles.
Well, at this point in time, ladies and gentlemen, as you can see, we're getting closer to the delivery of this baby. We certainly appreciate Melissa, Nurse Jenny, and our nurse anesthetist from East Carolina University College of Nursing, Frida, sharing this with us. And we will have more to share with you upcoming. Thank you so much for being with us. Goodbye.